Welcome to This Week in Health IT Influence, where we discuss the influence of technology on health with the people who are making it happen. Today, Marty Paslick, the CIO for HCA Healthcare, joins us, and we have a really great conversation. We cover so much ground. It's really amazing, and I think you're going to really enjoy it. My name is Bill Russell, former healthcare CIO coach, consultant, and creator of This Week in Health IT. As we approach 250,000 downloads for the year, I want to thank Sirius Healthcare for supporting the mission of our show to develop the next generation of health leaders. Their weekly support of the show and our channel sponsors as well has allowed us to expand and develop our services to the community, and for that, we are incredibly grateful. Now, on to our show. All right, today we have Marty Paslick, the CIO for HCA Healthcare, with us. Good morning, Marty, and welcome to the show.
Good morning. Good to be with you, Bill.
Wow, I'm excited to have this conversation. This is actually the first time that you and I have met. We're going to cover a lot of ground, but before we do, I want to give you the chance to really tell us a little bit about HCA Healthcare. I'm sure everybody has an idea of what it is, but give us an idea of HCA and your role at HCA.
Sure, my pleasure. Well, our company was founded more than 50 years ago, and there was a trio of founders, and two of those founders were physicians, Dr. Fritz Sr. and Dr. Fritz Jr. And they had the vision almost 51 years ago that they wanted to create a health system that really emphasized high quality and high efficiency. And so that began the journey of our company. And today, I would tell you that the mission of the company is pretty important to us. Matter of fact, you can almost see the sign up above my desk over there, and we just really feel compelled to the mission statement, which is above all else, we're committed to the care and improvement of human life. And some companies feel like they have to create a mission statement as a check mark or just I got to do this sort of thing. But I would just tell you that at HCA, it's much more than that. And you got colleges that have that little phrase that connect people who support it, like Auburn has War Eagle or Alabama has Roll Tide. Well, I would tell you, inside of HCA, if one person says to the other, above all else, they don't have to say the rest of the mission statement. It's just an automatic connection to who we are and what we try to do. And that's why we have nearly 6,000 IT professionals in the organization. But I would tell you that they would tell you that they would prefer to be called a healthcare professional first before being called an IT professional. And so the basics about HCA, we have more than 2,000 sites of care across the U.S. It includes 187 hospitals. We are in 21 states. And then I guess for me personally, I've been the CIO for HCA since 2012, and I have been with the company 35 years. I started as a software developer for the organization, and I would tell you I'm not unusual. The senior leadership team is made up of a lot of high tenured individuals who all started as individual contributors of the organization. And so that's a unique trait, I think, about our organization that kind of sets us apart.
Well, just out of curiosity, so you're CIO for HCA, the entire system, because we've seen you have some regional CIOs, is that right?
That's correct. So we're set up in 14 domestic U.S. divisions today, and each of those divisions have a CIO that reports back up through the organization to me. We also have CIOs that are focused on very specific components of the company. So, for instance, Parallon, that does our business operations, has a CIO. Health Trust, that handles our supply chain logistics and our group purchasing organization, has a CIO. Sarah Cannon Research Institute also has a CIO. And then we have about 4,500, 5,000 employed physicians, along with urgent care that are on that organization called Physician Services Group, also has a CIO as well.
So you have to be thinking, I mean, the thing that's distinct about HCA has to be scale. Everything you do, you have to start with the idea of, yeah, we can do it for this one entity, but we've got to think a much larger organization, I would imagine.
No, absolutely. I mean, I think that especially when we work with small, innovative companies, it's one thing that we can bring to the table. Honestly, they might be bringing a great idea or a great concept, but what the organization is looking to us to do is hey, make sure that thing will scale across the organization.
Yeah, and that's when you're a small organization and you're hooking up with HCA, you got to think, yay, we got this big deal. And then you get in and you realize, oh my gosh, this is big. This is huge. I would imagine those startup entrepreneurs go through the range of emotions after they get going.
When we first started to build our, and I think we'll talk about today about data, our clinical data warehouse, we had a vendor working with us, and we were in a meeting one day, and they were struggling a little bit. And I don't think the representative knew what they were saying in front of us, but she finally just stopped and said, "We just realized that you guys are really, really big," and it was an accurate statement. So it's always a challenge, but I will say once we get either a workflow or a technology working here, it's pretty much industry ready. That's for sure.
Yeah, it's vetted. So we didn't really get the opportunity. We did a COVID series in probably April, May timeframe, and we didn't get a chance to talk. And I want to walk through some of that with you because an awful lot happened in early 2020. It's still going on today, but I specifically want to go back to early on in the pandemic. Give us an idea of how your role shifted and what were some of the things you were being asked to do as a technology leader during that time?
Wow. On one hand, it seems so long ago, and on another hand, it seems like it was just yesterday. Everything changed, and I'm sure all the other CIOs and other technology leaders you've talked to basically say the same thing. For me personally, you get to a place in the organization, especially one like ours is so large that your role is primarily that of a consultant. You're consulting with people, you're providing them your years of experience, your knowledge, you're helping them with decisions, and then all of a sudden, and really almost that quick, you walk into your office and your schedule has disappeared. It's gone. There is no governance meetings to go to. There are no other types of activities. And for me, at least personally, I rediscovered the operator inside of me. And so we had to take some fast action. We had operational impact, clinical impact, technological impact. So the first thing we did was we halted more than 375 projects, halted or severely slowed them down. And we pivoted to sit down with our operators, sit with our clinical operations group, and really try to understand what were the critical things that we needed to pivot toward. Early on, you would say laboratory interfaces. So we were quickly negotiating with reference labs, and we needed to construct those lab interfaces overnight. And I think, and as for my role, it turned out that I always try to emphasize a flat operating model, even though with 6,000 people, we just talked about the CIOs, there's a hierarchy, right? But right. Operationally, I wanted to have a flat operational model. Well, during COVID, it became as flat can be because we just all became colleagues. And with the collaboration tools like WebEx Teams, we were just kind of all in there together. I'll give you a great example. In those early weeks, we were trying to build these interfaces to these reference labs. And I'm a part of each of these WebEx team rooms. And one of our integration analysts just out in the open of the room just said, hey Marty, we need you to contact the CEO of this reference lab. They are telling us, and this is a Friday PM, he's saying their technical staff is telling us that they'll get back on this on Monday morning. And that is not going to work. And I called their CEO and said, look, God, I don't want to be over dramatic here, but lives are at stake here. And we need to process these labs as fast as we can, as soon as we can. And we're ready to work. We're ready to work through the weekend, do whatever we need to, but we need you to get your staff to help us. And sure enough, the CEO turned to his team, and early the next week, we had those interfaces up and running. And so for me, I became an operator again. And I think that goes for everybody in our company. It doesn't matter what your role was. All of a sudden, you were very hands-on as far as our response goes.
Rediscovered your inner operator. That's a great quote. They didn't have you go back and start programming again, though, right? You didn't go that far back.
No. The developers, whenever I try to give them advice on software development, I get the rolling eyes pretty fast.
It's interesting because you guys have such again, I can just go to scale. This pandemic was not experienced like we thought originally. We thought it was just going to spread all the way across the country, and it turned out to be really a local impact. But it sort of manifested itself significantly in New York, significantly in New Orleans, Seattle, some locations, but in other locations, we saw a very slow ramp up. Now it's ramped up in a lot of places today here in December, but early on, I mean, did that create some challenges for you in terms of just how it was being experienced unevenly across your system?
Well, not. So you're absolutely correct that COVID strikes in different degrees, but we have seen across almost all of our markets, 21 states, the ebbs and flows of COVID. So when it gets back to the technology part and the things that we had to do, it really didn't matter about whether or not it was a surge or not. I'll give you a great example. Regardless of where you were, hospitals across the country went to a no visitor policy, rightfully so. And so we had to quickly pivot toward how do we get a connection between patients and their families, and so it just did. In a case like that, it just didn't really matter. And then when you think about PUIs, people under investigation, without having that and without having a good lab turnaround time, the PUIs were having to be treated just like COVID patients. And so some of the forces, even though we didn't experience in New York per se, some of the things that we had to do were still as critical and still as time sensitive.
So let's talk about some of those digital projects and specifically around video, telehealth type technologies and those kind of things. So you talked about bringing patients and their families together. What kind of projects? What did that look like from a technology perspective and from a rollout perspective for you guys?
Well, we were really fortunate to tell you the truth because we had some great foundations. So before COVID, we already had a great telehealth foundation. We had more than 1,000 programs that focused on things like rural outreach, stroke identification, behavioral health assessments. So we had a very solid understanding of telehealth, and we were actually executing it quite well in a very decentralized way across the health system. But as health systems had some new use cases that amplified really fast. So I mentioned one of them, and that is we went to a no visitor policy. And so not only did we have to figure out how to get the equipment, iPads or whatever, into our ICUs or med-surg rooms, but we had to train people. We had to get it all running, basically. And so we had Apple was a great partner. We're one of the largest iOS users in the industry, but we still didn't have enough devices. So we literally had tech analysts walking through administrative offices, grabbing whatever iPads they could, going into patients' rooms, and I'm not kidding you, literally duct taping the iPads to IV poles. And it was important. It was important to create the connection between a patient and their loved ones. And honestly, it created a better connection between our care teams and the families instead of a voice call. So that one in particular was pretty important to us. The other foundational thing that we had going for us was that we went down a path a few years ago that we wanted to go mobile. And we wanted to supply our caregivers with a communication platform that we can not only use for voice if needed, but also use for texting and come COVID for the video capabilities as well. So we have about 80,000 iPhones that are distributed across the company that we actually used for mostly the text messaging, but gave us that great foundation in order to operate. Actually, if you look at 2020, which is really the COVID year, up to December 1st, that platform executed almost 170 million text messages. Wow. And if you think about the speed in which something like that happens, it's pretty important. The other big use case, which we actually had work done in it, was really the idea of the physician to patient connection, right? I mean, we had some of that activity occurring in our hospitals before, but we saw this rapid increase in use by our physicians. We went from, I think that 2019, we had about 3,000 physician to patient interactions, 3,000 in 2019. And so far in 2020, we've had 800,000. And so the good news is we had the technology in place. We had to make sure the workflow was efficient. But as you can tell, we went from a very low number of physician to patient interactions, say like you're a family doctor, to nearly a million video telecare cases.
Those are some staggering and amazing numbers. I'm curious. I want to ask some sort of a follow-on question about standards, right? So you have those regions, you have those different entities. Do you require the same solution across the entire enterprise, or do you just, or do you allow some leeway in the time of a pandemic to say, look, we're not going to be as stringent on standards. Let's get the solutions in place, and then we come back to it later.
Well, like I said, I thought we had a really good footprint. I mean, we used One Touch a lot across the organization, and that became the kind of the primary tool. But to your point, some vendors do dictate the tool within their system. So we use eClinicalWorks for our physicians, our employed physicians, and so obviously we were leveraging their technology within their platform. So there might have been a variation across the enterprise, but the use cases were fairly standardized. I had this, and we use, for the ICU case, we use primarily WebEx, and Cisco was a great partner through all that activity, and I had the chance to speak to one of their customer advisory boards, and I said, I think everybody looks at WebEx from a COVID perspective and go, wow, look at all the meetings. And sure enough, we use it for a lot of meetings as well. But the one thing I wanted to emphasize to not only other customers of WebEx, but to the engineers at Cisco, was, hey, your technology was one of the most critical means for a patient that might, for the last time, talk to their family. And I don't think sometimes we as technologists ever come to grips with really how close we are to a patient. And in the case of what we were doing in the ICUs, WebEx was a critical component. So overall, I would say very standardized in use cases, but different tools used based on the use case itself.
So you also utilized the Microsoft COVID-19 chatbot self-assessment tool that was out there. How has that worked for HCA, and where can you imagine that technology going next?
It was just amazing, to tell you the truth, is that what a great partner Microsoft was. They had contacted us and said, look, we've spent some time with some our engineering. We believe we have some technology that we think can help. Can we help you, basically? And we're good partners with Microsoft already. And we said, sure, let's do this. This is just, I can't even, again, it's all about COVID speed, right? But from the point we said, hey, let's do this, till the point we had it operational was just a few weeks. It was 2 to 3 weeks, and it was operational across the enterprise. And I would just tell you, from a patient's perspective, their alternative before that was to the internet, Googling and things like that, or it was calling our contact center. And our contact center was doing its very best to keep up, but you can imagine there was quite the volume of calls that were coming in. And here all of a sudden, we had a very structured workflow that delivered great information to the patient, and it also provided guidance at the end. You should go here, or you should do this. And so from a patient's perspective, it was fantastic. And then from a contact center perspective, it allowed our contact centers to focus on other types of activities during the COVID surges.
Do you think so what's the follow-on? I'm asking you to put on your chief digital officer and say, hey, that was a pretty successful pilot, if you will, maybe full-scale production pilot, but where does it go next?
Well, I think I speak for any healthcare system that you would talk to, that when it comes to bots and comes to automated workflows, we're all just we're in the early innings of these things. But I can guarantee you, whoever you talk to is doubling down in that space right now. Yeah. I mean, the one thing I would say about our patients is during COVID and post-COVID, there are two things they really want. Obviously, they want quality care, but inside of that umbrella of quality care, they want convenience and they want to have confidence. And I really do believe these digital bots and the digital patient journey, if we're able to digitize more and more of what the patient needs to achieve those two things, then we're going to have a better experience.
Yeah, and that's huge. I do want to delve into data and information, really data. During COVID, we've heard stories of people standing up dashboards in record time, and just the different information that was required, the information that had to be sent to the states and put into registries. Give us, this is going to be a huge question, but give us an idea of some of the work that you did around data and around visualizing the information for the caregivers and for the executives.
Well, this is a little bit of a history lesson, but more than a decade ago, we made the decision as a company that we would create our own standalone clinical data warehouse that not only included EHR data, but included any other data that we wanted to assemble together in order to get those kinds of insights. You may have heard some of my colleagues in different other settings refer to our company as a learning health system. And it really does start with the clinical data warehouse, where we have nearly 45 million patients in that data warehouse, over 150 million encounters. We track more than 4,000 unique data elements for the patient. So that foundation is the table stakes. And so going into COVID, we were already very fortunate to have just an unbelievable set of data to start with. Now, when you have that, you got to have somebody or some team that can leverage it. And the other thing that HCA is very fortunate, and other health systems as well, have jumped into the data science space. But we have the company as a data science team that they're just amazing, is all I can say. And they're magicians in my eyes. And they created a technology, a platform they call it Nate. And that platform, especially when it came to COVID, was highly tuned so that we could follow our patients, offer information, insight. We could predict surges. We could predict bed statuses. We saw all of that activity all the way down to the single bed. And it was just phenomenal about how it enabled us to not only care for our patients inside of our hospitals, but actually care for them across a marketplace as well. So we could leverage, back to scale, leverage all of our assets just because of the insights that we could get. The other area is that we, again, before COVID, we began the creation of a product called Rhythm, which is, in simple terms, just tiles that represent all kinds of different metrics in our organization, from census to supply chain to lab turnaround times. And the tiles are completely configurable by the operator. And then each tile can be set up for alerting. So if turnaround times increased beyond a level of acceptance, an operator would get a buzz in their pocket that says, hey, you got to go look at in the ED or look at something in supply chain because something's not going right. And so having that real-time kind of tile-based system was really, really important. And then the data also enabled us to create some great partnerships with some other companies. So I don't know if you are familiar with our relationship with Google during COVID, but we helped them create the overall national response system, which took data from us and included it with other types of healthcare systems in order to do even broader predictability. And then we worked with GE on their command center product, which not only gave us great kind of you're talking about dashboards, gave us some great air traffic control type of tiles, but the residue of that benefit was that some of our data was being combined with other health systems so that we could get a better idea from, for instance, the state of Florida, to get a better idea of what the surge was doing on a broader scale by combining our data with others.
You know, that's here's the thing that's fascinating to me about that. You already mentioned eClinical work, so I'm going to assume you're not on a single EHR from one end to the other. In fact, you're probably pretty far from that nirvana, if you will, of one EHR from one end to the other. But you've been able to, because of that data warehouse, you've been able to take not only the EHR data, but probably a lot of other data sets and create a really powerful and useful resource in that data. Instead of relying only on the EHR, you're able to create a more holistic view of what's going on, not only in your system, but in the communities that you serve.
You're absolutely right. Now we are fortunate that in the employed physician space, the majority, 90+% of our physician practices use ECW. The majority of our hospitals use Meditech, but we have an Epic presence inside of our hospitals. We have a Cerner presence. But to your point, the really sweet part of it all is it's all in this abstracted database. And today we're including things, I mentioned mobile heartbeat and the communication platform that we have in the company. And the really cool thing is we are now taking data from those text messages and including that in the warehouse as well to see if we can see correlation between text message volume and outcomes. And so the ability to take data from all the sources that we're talking about is really powerful.
So given our time, I'm only really going to have two questions left. I'm trying to figure out which Let me see if I can squeeze these together here. So care at a distance, reducing touch points. We talked about chatbots, which is one of those ways that we reduce the touch points. What are some other ways we reduce touch points in the care workflow in order to protect the caregivers and the patients?
Well, I just would tell you that we were already in lots of different parts of the company making solid strides to improve the patient's digital journey. But as you're alluding to, COVID kind of changes the game, and we've got to find a way to either limit or eliminate waiting rooms. We have to do our best to remove registration desk. We have to do our best to schedule at the convenience of the patient. And so the full digitization of the patient's journey is an obsession with us at HCA now. And in the middle of the summer, we decided instead of having one group focusing on digitizing the financial journey versus a clinical journey versus an inpatient versus an outpatient, that we just bring the whole organization together. So the first time in my history here at the company, we have a team of more than 100 technologists that are focused on a capability versus an kind of an organizational alignment. So we have a team called the Patient Digital Journey, and their job is digitize it all. We want to see ourselves digitizing driver's license, insurance cards. We want to make sure that we use messaging as a workflow. We want to, if you want to come see us in an urgent care, we want your waiting room should be your living room. Yeah. And we should, based on traffic or whatever, go, hey, we are ready to accept you. Once you're in our parking lot, text us that you're here, and we will bring you into the urgent care. That's where, back to convenience and confidence for patients really matter. And so I'm super excited. 35 years with the company, you can start to guess my age. I'm quite the user of our healthcare system as well. And so I always look at this, hey, this is what I want. As a patient, this is how I want to engage with the organization. And I'm just so excited that the CEO of the company feels exactly the same way. I would tell you that the digital journey for the patient is a top 2 or 3 technological priority for us at HCA.
So actually, we used to, when we said, hey, we're bringing these teams together, we used to like fly them all into Nashville, put them in a room and have conversations. But from a work from home standpoint, they probably all are just meeting virtually. Is that essentially how you guys are doing it? And are they coming in from all over the country or mostly Nashville?
Well, so first of all, we were again you get lucky a little bit, and IT was already a telework organization prior to COVID. Now, not like it is today, obviously, but we've been teleworking since 2003. So we had at least a taste of it. And so when COVID sent those type of colleagues home, you're exactly right. We started to work from all different directions and all different teams. I mentioned the GE Command Center. Well, using WebEx Teams, we had a team room where we had engineers from GE and engineers from HCA from all over the country working step by step and updating each other through that team room activity. You know, one of the funniest moments was someone in one of these team rooms one day says, hey, I'm going to schedule a meeting next Tuesday. And I was being a little bit of a smart aleck, but I responded, what's a meeting? and my whole point was, this is the meeting. This workflow that's going on in this team room is the meeting. Yeah. And so if you got something to say it in here, and let's get the work done. And so my biggest worry is actually burnout. I think our technologists, because of the mission, they'll do anything. Early on, I usually get this report that says that shows any of our colleagues that have worked more than 60 hours a week for 3 weeks in a row. Because I want to check in, see what's going on. Well, I asked them to run the report back in May, and we had a dozen to 2 dozen employees that it wasn't 60, it was 80. And so I called them up for little 15-minute calls, and the same response happened time and time again. And that was back to them being healthcare professionals. And they say, look, I've always felt connected to the patient, but I realized this was my moment. I had to get that lab interface up. I had to get this body of work done. And I was going to do whatever I had to do to get it done. And so one of the things that I'm trying to stress with our management team is stay connected to these great technologists and make sure that we're getting the work done and we're doing it in a mission motivated way, but that we're also staying healthy.
Yeah, it's a different work environment, and when you don't see them every day and you don't talk to them every day, they can get lost. And it's great that we're starting to see the management structures form around this. But you already had experience with it. Here's Marty. First of all, thanks again for coming on. This has been a great conversation. I want to close with this question: what do you think the lasting impact of COVID is going to be on health IT in your organization?
Well, I wish I had $1 for every time I've turned to the organization and I've said, I'm not going back. I am not going back to pre-COVID. And when I say that, I'm really talking about, we've had this phrase, and I'm sure every other health system says the same thing, and we call it COVID speed. And that is, what did we learn? How did we become so fast at everything? Well, some of it was what we just talked about, mission motivated, right? People who saw their moment, but that's not the sustainable part, obviously. But we also discovered the power of WebEx, the power of really using a team room to have activity moving all at one time and really staying in sync with each other. And so I do think COVID speed is real, and it's going to allow us to say, look, you can have a portfolio back to 375 projects, but which 50 of those projects are critical for the company's success? And are we willing to commit the resources and the money to optimally move those along? I can say for HCA, that lesson learned is the answer to that question is absolutely yes. And so we're seeing ourselves stratify our portfolio so that we can really concentrate on the things that make the biggest difference and then make it happen. At the end of the day, I don't know what else to say about what we've learned, except that I feel like, at least at HCA, and I'm sure many other people would say the same thing, that from a technology perspective, if we thought we felt close to the patient before COVID, we found a whole new level. Whether it's digital patient journey, whether it's telehealth, we found a new connection. And I mentioned earlier in our conversation today about our mission statement, and I just would sum up that it all comes back to being above all else. And I think for our organization, our commitment to our clinicians and our patients and the rest of our colleagues has really been amplified by COVID, and we're never giving it back.
Yeah, that's fantastic. Well, Marty, again, thank you for your time and just taking the time to share your experience and your expertise with the community. It's really appreciated.
Bill, thank you very much for the invitation. I really enjoyed spending time with you.
What a great conversation. That's all for this week. Don't forget to sign up for Clip Notes. It's a great way to support the show. It's also a great way for you to stay current. If you're not familiar, Clip Notes is an email that we send out immediately following the shows, actually 24 hours after the show airs, and it'll have a summary of the show, bullet points, key moments from the show, and also 1 to 4 video clips that you can just watch. Great way to stay current, to know who was on the show and what was said. A special thanks to our sponsors, VMware, Starbridge Advisors, Galen Healthcare, Health Lyrics, Sirius Healthcare, Pro Talent Advisors, Health Next, McAfee, and Hillrom Digital, our newest sponsor, for choosing to invest in developing the next generation of health leaders. This show is a production of This Week in Health IT. For more great content, you can check out our website, thisweekhealth.com, or the YouTube channel as well. We continue to modify that for you to make it a better resource for you. Please check back you want to check back. We publish 3 shows a week. We have the Newsday episode on Tuesday. We usually have Solution Showcase every Wednesday and then an influencer show on Friday. But right now we don't have any Solution Showcases, so we are doing we're dropping multiple influence episodes. So a lot of content being dropped between now and the end of the year. Hopefully you'll like that. And also we have the end of the year episodes coming up, and I'm looking forward to those. We have the Best of the Newsday show. So we take 10 news stories that we covered this year and give you some clips, give you an idea of what we went through this year. Obviously, COVID was the big story, but a lot of other things happened this year in the world of health IT. We're also doing a best of the COVID series itself. If you remember, we did 3 months of daily episodes, and we go back and we visit that time and just some of the wisdom that was dropped by the leaders during that. And then, of course, we do our end of the year top 10 countdown of the top 10 most listened to shows of the year. So you're going to want to stay tuned for that. We take a break the last 2 weeks of the year, and during that time, we don't stop dropping content. We just prepare it ahead of time and make it available to you. So hopefully you'll enjoy those this year as well. Thanks for listening. That's all for now.